Hello, I am Enrique Quesada, and this is Mexico Centered, a podcast from the Center for the United States and Mexico at Rice University's Baker Institute for Public Policy. As has been the case around the world, the coronavirus pandemic has significantly and negatively impacted the Mexican economy, shutting down many industries and disrupting the production chain across North America, as well as resulting in loss of employment. According to a survey by INEGI, Mexico's National Institute of Statistics and Geography, around 12 million Mexicans stopped working, having been furloughed or laid off. To mitigate this blow to the economy, on June 1st, the federal government began to reopen and allowed certain industries such as construction and auto manufacturing to resume operations. This, as the country registered over 4,000 new cases on June 4th, for a total of approximately 105,000 confirmed cases of COVID-19. 12,545 people have died. Is the country ready to reopen? How have the strategies that the Mexican government has implemented worked in mitigating the spread of the virus and its impact on the economy? What has been the impact on the binational relationship between the United States and Mexico? To discuss this and other issues, I called Tony Payan. Tony Payan is the François and Edward de Regin Fellow for Mexico Studies and Director of the Center for the United States and Mexico at the Baker Institute, as well as a professor at the Universidad Autónoma de Ciudad Juárez. Here's our conversation. Tony Payan, Director for the Center for the United States and Mexico, thank you for being on the podcast once more. On April 1st, the Center hosted a webinar to discuss the Mexican government's response to the coronavirus pandemic up to that point. You talked about the social, fiscal, public health, and political measures that the government had implemented or had failed to implement. It's been 2 months since then. What is the current situation in Mexico now, and how has the government's response worked?
Thank you very much for the invitation, Enrique. I'm very happy to be here with you again to talk about the response of the Mexican government to the coronavirus crisis. Indeed, it has been 2 months since we had a conversation on this very issue at the Center for the U.S. and Mexico, and I can tell you that almost all of our predictions have come true. At that time, we thought that the Mexican government was being a little neglectful of its duties. The pandemic was moving still through China onto Europe, and it was sort of picking up in the United States. And clearly, it wasn't quite there yet in Mexico. So Mexico had ample warning of what the pandemic was going to do, what it was going to look like. There was a very clear understanding that the healthcare system in Mexico was not ready. There was also a very clear understanding of what was happening to the economies of Spain and Italy and other places in Europe. We knew quite a bit about the lethality of this particular virus, and yet the Mexican government chose not to act decisively, effectively on the virus. And the worst case scenario has now come true. 100,000 confirmed infected individuals in the country. We really do not know how many people are infected because the Mexican government chose not to test. The number of tests is very low. We're talking about 0.5 tests for every 1,000 individuals. And Mexico, I think, has now surpassed 10,000 individuals dead. That is a morbidity rate of about 11%, I think, which is quite high. It's one of the higher mortality rates in this pandemic. And of course, this is still spreading unabated in many Mexican cities, especially Mexico City. So the worst case scenario that they could have anticipated and prepared for, they didn't. And so the situation in Mexico is quite dire. And now the Mexican government has decided to reopen the economy, to relax the measures such as social distancing and so on. And so over the next month to 2 months, I think we should expect this to get worse in Mexico. And there really is no two ways about it. That's just the way it is panning out in Mexico, in spite of the fact that they have plenty of warning.
So during the webinar in April, we talked about this, how Mexico at that moment had few diagnosed cases of coronavirus, right? And we talked about the issues with testing, that they weren't testing enough, and the strategies the government was implementing. And so there was a controversy over numbers, and there continues to be one. This controversy has not subsided. According to an investigation by Mexicans Against Corruption, the number of deaths from coronavirus in the country's capital, Mexico City, could be 3 times what the official number is reported by authorities. So if you could talk a little bit more about why there is so much controversy around these numbers, whether it is number of deaths, confirmed cases, the models that the authorities are relying on.
Yeah, this is an important question. Obviously, much like in the United States, Mexico designated a particular individual. In the U.S. is Mr. Anthony Fauci. In Mexico is Mr. Hugo Lopez-Gatell, presumably the chief individual designated as the head of all efforts to coordinate all efforts against this pandemic. Mr. Gatell, however, began to lose credibility very quickly because from the very beginning, he has sent contradictory messages, not only about the danger of the virus itself, but about the model that he's been using. He's giving different numbers. In the beginning, he said he used the Sentinel model, which many countries very quickly discarded because it's a good model when you're beginning a pandemic, sort of understand, kind of make some projections and understand what was going on. He refused to discard that model, even after many countries, especially, for example, the UK, had already discarded that model and moved on to the idea that they had to test. They simply had to accelerate the testing to understand the dimensions of the pandemic. He clung to that particular model for much longer than it was required. He gave different numbers at different times, for example, arguing that the number of infected individuals by his own calculations had to be multiplied by 8, and then by 20, and then by 30, and then by 40. So he kept changing it. And then, of course, he made some very controversial political statements, such as the fact that when the president was still traveling at the end of March, he said that the president could not possibly be a vector of contagion to anyone. So that's a political statement. And I think it's quite contrary to what Dr. Fauci did in the United States when he was asked about the politics behind the pandemic. And Mr. Fauci was very clear before Congress saying, I don't give you any political recommendations. I'm talking science, I'm talking numbers, and so on. The politics is up to you, Congress members. Not in Mexico. Mr. Gatell has made some very strong statements against the president's critics. He has defended the president. And of course, he has also engaged in quite a bit of a fight with some members of Congress, most recently in the Senate. So clearly he's seen more as a political figure. In fact, some of the people that I've talked to have essentially said in the healthcare sector in Mexico have essentially said that they do not view him as a leader. They view him as a political facade, as a political manager, more than a public health crisis manager. So clearly, even in the public health care sector, there is very little faith in what he has to say. So slowly, I think the credibility has been eroded. And of course, there are many people who defend him quite a bit. But interestingly, the people that defend Mr. Lopez-Gatell are people who are very loyal to the president himself. So that in and of itself is sort of splitting along political lines. Mr. Hugo Lopez-Gatell did not take care that this issue not be politicized. He politicized it himself. He acted as a political agent, and then, of course, made terrible mistakes. And then now that the pandemic is still climbing at an increasing rate, because the curve is not flat by any means, he has endorsed the president's idea that it's time to open the economy. And that goes against just about every other experience in every other country, and of course the recommendations of a good number of epidemiologists. So Mexico is just not handling this crisis very well. It's too late, though. It's politicized the way it got politicized in the United States. And of course, there's a lot of pressure for Mexico to open the economy because it is estimated that 12 million people lost their jobs. And that, for a country of 130 million, is just phenomenal loss, similar to that of the United States anyway, but terrible in a country with much higher degrees of poverty.
Yeah. So in a previous episode of the podcast, I had mentioned that local government officials, parts of the private sector, and citizens were taking precautions before the federal government had implemented any measures. And we continue to see a lack of coordination between states and cities with the federal government. For example, now some governors want to open up more of sectors of their state economies or want to do it at a different pace. What do you see as the reason for this lack of coordination, and also, what are the implications?
Well, by definition, I think the pandemic is experienced differently in different places. It is quite intense in Mexico City, in the state of Mexico, in the state of Puebla, in the state of Veracruz, of course, in Baja California, and it is considerably less intense in other places, perhaps in Chiapas and a few other states. So it's a pandemic of many different speeds. And what you need to do is to have a very clear guidelines at a national level, and then allow those guidelines to have some adaptability, some flexibility for local governors and even mayors of large cities like Monterrey and Guadalajara and other places to make adjustments according to their own conditions on the ground. That has not been the case. In fact, I think Mr. López Obrador has been fighting with the governors and the mayors of large cities, and that political fight that has been going on before the pandemic has, of course, I don't want to use the word infected, but has sort of been conveyed to the management of the crisis itself. And so many of the governors are beginning to say this is not acceptable, especially after Mr. López Obrador refused to really address the pandemic head on. He delegated that to Mr. López-Gatell. He deserted from saying any substantive things about the pandemic himself in his morning press conferences. And of course, many of the governors, of course, he refused. He refused also to put together a rescue packet for the economy. And the governors are feeling the crunch in their own states in different conditions. And so this was a mistake. There was a political mistake. And now the governors very quickly understood that they're on their own, that they have to create their own models, their own semaphores, their own response to the pandemic. And they moved to do so, correctly so. But you cannot leave 32 governors on their own without any serious, incredible, science-based, fact-driven national policy on the issue or the different issues that the pandemic is creating, from the public health crisis, managing the dead and the sick in the healthcare system, all the way to the economy. So this has turned into quite a bit of a political crisis, and many of the governors have refused to accept the federal government instruction that the economy is ready to open, and they have defied the semaphore, the kind of a light system, green light, red light, yellow light that the federal government designed in 4 stages. And they've simply said, no, we're not going to follow the federal government. We're going to consider the circumstances on the ground and follow those. And even some of the governors emanating from the president's own political party, Morena, like the governor of Puebla, have simply said the conditions are not right to open. And the mayor of Mexico City, which is who is also a member of the president's party, essentially engaged in a spat with Mr. Hugo López-Gatell just yesterday, saying that Mexico City is simply not ready to open. So it's quite chaotic. It's a very uneven, chaotic, and politicized response where we are now, even as the virus is still spreading and wreaking havoc in the population.
So moving on to the healthcare sector, with more than 11,000 confirmed cases of coronavirus among healthcare workers, some estimate that that's around 20% of all confirmed cases. Hospitals are struggling to keep enough staff to treat patients. In addition, many of them do not have enough equipment. The New York Times quotes a doctor from Tijuana saying that in many cases, quote, "It's not the virus that is killing them, it's a lack of proper care." end quote. What is the capacity of Mexico's hospitals to deal with the pandemic, and what has been the role of the federal government in this lack of preparedness?
There are several important structural issues with the Mexican healthcare system. First of all, it is quite deficient in terms of its capacity. Among the OECD countries, I think it ranks last or close to the very bottom of the countries in terms of beds available, hospitals, coverage, and on and on. So the system itself was already ill-equipped to handle a spike in the number of individuals that needed to be hospitalized and tended to in the healthcare system. In addition to that, in 2019, the federal government implementing a program of what they call Republican austerity. It's essentially a fiscal austerity program that is quite draconian. They cut at least 1,200 million pesos out of the healthcare system. So instead of investing in the healthcare system, they starved it quite a bit. So they were caught without resources. They were caught without equipment. They were caught without the beds, the hospitals, the personnel. In fact, there is an estimate that Mexico requires between 200,000 and 300,000 more medical personnel without a pandemic, just as a country. There's 200,000 to 300,000 more medical personnel, nurses and doctors required in the healthcare system. So it was already way below par. And then, of course, the president also in December 2019 canceled the quite popular health insurance program that was created under the Fox administration back in 2012, 2004, 2003, 2004, 2005. And was quite popular, which was essentially an insurance program by which the federal government transferred money to the local hospitals, to the local healthcare systems. In exchange, they would give attention to individuals who did not have access to the healthcare system. So there was a transfer of resources from the federal government in exchange for attention to these individuals. And people got used to that over the last 15 to 17 years, and it was quite good. It was working well. I mean, obviously, it probably needed to be fixed, and maybe there was some corruption that needed to be fought in the system and so on. But the president went straight ahead and canceled the program in exchange for something called the INSABI, the Institute for Public Health and Wellbeing, which was rolled out without resources, without personnel, without cash transfers into these hospitals, without a structure, without rules and regulations. It was a disaster. I mean, rolling out a new institute, especially in the healthcare sector, is very difficult. And then you do it quite incompetently, and you don't phase the old system in and then phase the new system. Or phase the old system out and phase the new system in. You don't do that. You simply just cut the old system and start anew. Well, that didn't work. That didn't go very well. And people were left without coverage, the hospitals without the resources they were being given. It was quite a disaster. And so at the end of the day, what this has done is that it's punished the poorest the most. The very people that the president claimed to defend are the people that are being punished by not only getting sick because they have to go out and work, a lot of them working in the informal sector and maquiladoras and so on, but also by the fact that they no longer have coverage and the system will not give them coverage. So it's been quite mishandled. I mean, it's a real serious crisis of incompetence in the Mexican government today.
Now, in regards to the binational relationship with the United States, trade has been impacted as a result of many manufacturers in Mexico stopping operations during the pandemic. The supply chains are affected, as some businesses that are considered essential in the United States are not deemed as such on the other side of the border in Mexico. What kind of pressure is Mexico receiving from Washington to open up certain industries so that the supply chain can be restored?
Yeah, I think Mexico City, the Mexican government, is under pressure to reopen the economy. And I think one of the reasons is that suddenly the United States, sometime in May, decided the economy is to reopen. And that means the factories, manufacturing. And you have to remember that the United States continues to be one of the main manufacturing powerhouses in the world. A lot of goods are manufactured in the United States, in spite of the fact that it employs less people and there's a lot of paranoia about China. The reality is that the United States remains a manufacturing powerhouse. But over the course of the last 25 years, under the North American Free Trade Agreement, this manufacturing has essentially spread out throughout North America into Canada and Mexico, and they are quite integrated in terms of the chains of production. And so some of the parts for the trucks that are made in Detroit or are made in Michigan, Ohio, are parts that are put together in Mexico, and then they're transported to the Midwest, and then the final product is assembled in the Midwest. It may include, of course, software that comes from Montreal and so on. So you cannot open the factories in Michigan and Ohio if the factories that make the parts for that manufacturing process in the Midwest is not open in Mexico. So clearly that there was a famous letter that was published to 12 senators in the United States, some of them from border states. Obviously, they understand the importance of trade, asked Mr. Trump to press Mexico on opening the economy. And Mexico, especially the López Obrador administration, which has been quite interestingly acquiescent and almost obsequious towards the Trump administration, decided that it's time to open, and he himself decided that it's time to travel and so on, even though the pandemic has not really seeded at all in Mexico. So the economy is open. We know that a lot of the victims in Mexico are healthcare workers because they don't have the protective equipment, and a lot of them are maquiladora workers because many of the maquiladora plants refuse to shut down, and so many of them have gotten sick. Just in Ciudad Juárez, for example, somewhere around 600 maquiladora workers have become infected and died, in addition to the ones that have recovered and so on. So clearly Mexico is not ready, but the U.S. is ready, and Mexico will open because it will be dragged into opening by pressure from Washington, D.C. And I think this is a failure of leadership in both Washington, D.C. and Mexico City to a large extent to coordinate the response as a region in North America. A lot of issues could have been avoided if Ottawa, Washington, D.C., and Mexico City had coordinated a regional response in North America. That would have helped quite a bit. But obviously it didn't happen. I mean, it didn't even happen in the United States or Mexico. The states were left on their own in both countries because the leadership at the top, I think, is failing in both capitals. And now they're both determining that it's time to open no matter what happens. So we should expect more suffering and more death.
So to conclude, we have talked about how the Mexican government has responded to the spread of the virus, and in which the country systems are being put to test. The number of deaths now has surpassed 10,000. The economy is shrinking. Many jobs have been lost. The government provided little economic assistance to small and medium-sized businesses, so on and so forth. What's on the other side of this? In what shape will the country be after the first wave passes? And what will be the economic, social, or political implications of this?
Well, there are different predictions as to what the economic effect of this pandemic is going to be on both sides of the border. In the case of Mexico, obviously, there are different predictions. I think one of the lowest predictions I've seen is the Central Bank of Mexico, which is estimated 8 to 8.8% decrease in GDP in 2020. There are some estimates by some international banks that put that number at minus 12%. Regardless, I think it's a disaster. You have a country where 57% of individuals work in the informal sector. Many of them lost their jobs in the informal sector and the formal sector. If you put the two groups together, people who sell stuff on the streets and work on a daily basis and so on, as well as the individuals that are actually employed by companies, factories, and so on, we're talking about 12 million people. What does it take for an economy to produce 12 million jobs? That's a major effort no matter what. So even if we see a kind of a U-shaped or a V-shaped recovery, the climb, the other end of that V, the right-hand side part of that V-shaped line is going to be very slow. It's going to climb very, very slowly. A lot of people are going to be without jobs for a long time. Some estimates say that Mexico will need to grow at 4.5% over the next 4 years just to achieve the same level of welfare that it had in 2019, and it was already flat. The economy in Mexico is not going to grow 4.5%. The Mexican economy has not grown at that level since the 1980s. The Mexican economy has been at about steady 2%. So if it shrinks by 8 to 12%, it's going to take years to grow back up. Even if the recovery is a little bit faster because a lot of the economic activity will resume, it's still going to take years to recover the economic growth that is required to be at the same level as 2019, and of course to produce the kinds of jobs that are required to get all those people back to work, whether it's in the informal or formal sector. Now, what I'm afraid is that is going to also create a fiscal crisis, because the tax base is going to shrink by necessity, by the mere fact that the government is not going to be able to collect those taxes. So there's going to be pressure to raise taxes, which is kind of counter-cyclical. When things are going pretty bad, you lower taxes to stimulate economic activity. So there's very little room for maneuver. The president has refused to put together a packet, and he has refused to borrow in the international markets. And of course, he is himself engaged in a major political fight with the private sector in Mexico, and essentially said that the government is not going to rescue anyone. This is quite puzzling, given that most countries are actually pumping fluidity cash into the liquidity, into the economy. Mr. Lopez Obrador is running in the other direction. It's exactly the opposite. He's not going to rescue anybody. He's not going to borrow in the international markets. He's not going to inject liquidity in the economy. Nothing is going to happen. And the Bank of Mexico has lowered interest rates to try to stimulate the economy, but their room for maneuver is very, very narrow. So I expect the Mexican economy to be reeling for the next few years. And many in Mexico are now beginning to say that this sexennial, this 6-year term that Mr. Lopez Obrador is going to govern, is going to be a failed sexennial, more akin to the lost decade of the 1980s than to anything that Mexico needs to really create a solid middle class and recover from this.
Well, Tony Payan, Director of the Center for the United States and Mexico, thank you for answering these questions.
My pleasure. Thank you so much.
That was Tony Payan. That is it for this episode. Thank you for listening to Mexico Centered. Thanks to Lisa Huacata, our program manager, and to Tony Payan, the director of the Center for the United States and Mexico at Rice University's Baker Institute for Public Policy. You can visit our website at bakerinstitute.org/Mexico, where you can find our latest publications. Views and opinions expressed in this podcast are those of the guests and the host, and do not necessarily reflect those of the Center. If you have any comments or suggestions, you can email us at usmexicocenter@rice.edu. We would love to hear from you. Mexico Centered is available on Apple Podcasts, Google Play, Stitcher, Radio Public, and Spotify. You can subscribe through your favorite podcast app to receive all of our new episodes directly on your phone. I am Enrique Quesada. I will see you next time.